Many years ago in Montana, if you were sick or injured and needed to go to the hospital, there wasn't an ambulance to call. Instead, you would have called the local funeral home director and had a ride in a hearse. Thank you for joining us for this episode of Talking Health in the 406, where we're one community under the big sky. I'm your host, Jennifer Bamsicle, longtime healthcare worker turned health educator. And today, our guest is Francine Janik of Jefferson Valley Emergency Medical Services. So, Francine, can you tell me about the history? Like, where did EMS start in Montana? How did it get founded?
So EMS started with just neighbors taking care of neighbors. You know, we all have those people that, kind of like the old midwives and stuff. When somebody got sick, they called whoever that was good at taking care of people. And we did have physicians in the state that would make house calls. But in the 1960s, those physicians became fewer and far between in the small rural communities. And so they were moving out of the rural communities, going to the bigger areas where they could have a decent schedule and better pay and less call-out time. And in 1966, during the Vietnam War, there was a white paper wrote. And it said that in rural United States, there was more people dying from traumatic injuries than in the Vietnam War, and that the United States needed to do something about that traumatic death rate and needed to help fix it. And so the Department of Transportation at the time was assigned to look into this problem and to help fix it. And that same year they did the National, it was a Safety Act for EMS, and they started getting federal funds to create ambulance services. And like in Montana at the time, more than 50% of the so-called kind of ambulances were run by morticians and funeral homes.
Wow.
And so, like in Whitehall, the local funeral home director ran the ambulance service, and he used the hearse, the same hearse that he hauled the bodies in. And you would dial a phone number, and he would come when he felt like he was ready for him to come, and he would just put you in the back by yourself and drive you to the hospital. And I had a guy tell me that he had wrecked on the interstate. They were building the interstate system through Montana about that time. And he said that he had rolled a car and got ejected and was pretty banged up. He thought he was going to die. And it took a couple hours before somebody pulled over and found him and loaded him in their vehicle and drove him to town. And at the local gas station, there was a phone that you could make calls to the funeral home at no cost. And so people would take you there, and you would dial the funeral home, and the funeral home director would answer the phone, and he says, I'll get dressed and I'll be there. And about 30 minutes later, he would show up and pick you up and drive you 50 miles an hour to the hospital to Butte, 27 miles. And he said, I thought I was going to die. He says, I didn't know if I was going to make it to the hospital. But he said, I did, and I'm here to tell the story. But that was very typical across the state and across the nation, that the mortuary people were making those initial transports of patients.
Getting double use out of their stretcher.
Getting double use out of it. Well, after that 1966 white paper, they realized that that was not the most appropriate way to transport patients, and that we needed dedicated ambulances. And there was lots of talk about the mortuaries needed to upgrade and provide oxygen and maybe provide some medical training. And a lot of the morticians were not willing to do that. And so the one in our area, he walked in and brought his oxygen bottles and said, I think that the town needs to create an ambulance service to take care of these people.
Your family has a long history in EMS and law enforcement in Whitehall. So when did your family step in with that?
So in 1969, my parents moved about May of 1969 to Whitehall. And Whitehall did not have, other than calling the mortuary, did not have any central numbers for anybody to call for police or ambulance or fire. And how people called the police was there was a red light downtown, and you would go turn on the red light, and hopefully the police officer would see that was maybe on or off duty, and he would try to figure out where they needed the police at.
Oh my gosh.
And so the town decided to have my mother put a phone system in our house in 1969. At the same time, they were creating the ambulance in Whitehall. And so she was paid, I think, 8 hours a month to run a phone system. And it was kind of whenever she wanted to answer the phone, they wanted her to answer the phone. And Boulder had the same kind of situation. They had a person in a house answering a phone to dispatch services. And one Sunday, a good friend of my dad's got sick, and we were all at church, and he died because he couldn't get a hold of an ambulance. And my dad said, this is never going to happen again. And so they dedicated, my mom did 24 hours, 7 days a week, dispatching to make sure that emergencies were covered. And she did that for 45 years.
Wow. And now, was your dad like a sheriff's officer or law enforcement at that time when your mom was a dispatcher?
So originally my dad worked at the Anaconda Company in Butte. Yeah. He was a crane operator for them. But on his free time, in the evenings and on weekends, he would either work as a special deputy, it was called at the time, for the county, or he was a deputy town marshal. And so my dad from 1973 on was the town marshal, and he moved into working as a special deputy more. And in 1981, the Anaconda Company had a major layoff. And at that time, he lost his crane operator job, and so he went to work full-time for the Jefferson County as a deputy.
And then he wore many hats for many years. What were some of those hats?
So originally in EMS, my mom and dad helped start the ambulance. And originally, you only needed a first aid CPR card in fact, when you first started, they didn't have any training. A lot of the physicians didn't want people trained. You were just an ambulance driver. You put people in the back and you drove them as fast as you could to the hospital, nearest hospital. Then in the early 70s, they decided that probably advanced first aid and CPR was a good thing for people to have to learn how to do splinting and how to wrap wounds and how to move patients. In 1973, in about that time, 72, 73, the state started doing pilot EMT courses. And I think Drew Dawson said that he thought they were the third town in the state of Montana to have an EMT class. Boulder did, and Whitehall did. And they drove to the Helena Hospital and to the Butte Hospital, and they had classes in Boulder, and physicians taught this EMT class. And so this was a major hat he wore. He was closest to the phone when the phone calls come in, so he jumped in the car and usually went over there. And in the early years, he rode in the back of the ambulance and helped take care of patients whenever anybody needed something when he was around.
I see.
And he also assumed deputy coroner duties, and he did work on the fire department. And we also did all the brand inspecting, and we did all the burning permits. The dispatch center dispatched early on highway patrol, county sheriff, ambulance, fire, and any other agency at the time that might have needed any dispatching.
Wow. And that's probably how it is for a lot of towns in Montana, where you have one person wearing 5 or 6 hats, that in your urban areas, you have 5 or 6 people handling that.
And it's still that way in rural Montana. People do multiple things. They're on the fire department. They may be on the ambulance. They may do DES duties. They may do public health duties. People that decide to serve the public tend to serve it in multiple arenas.
Yeah. And it's interesting because I know I grew up in Whitehall, and your dad was not Sheriff Jono. It was just Topper. And everybody just referred to him as his first name. And I can personally remember getting picked up from Girl Scouts in just a Whitehall neighborhood one afternoon and having my grandma get flagged down, and somebody saying, "Can you show me where the police department is?" And she says, "Yeah, it's that red house right there." And so all of this was based out of a home.
The home, when people had a domestic going on in their house, a lot of times the domestic showed up right inside the house. One person would run in and the other one would run in, and we'd have this big fight.
Wow.
Right in the middle of the house. I can remember one time we had a young man showed up at the house, and everybody that wanted assistance for like fuel and food would come to our house and get a background check done on them, and the churches then would give us money to disperse to those people to move them along down the road. And this one guy come in, and he sat down and on the floor with all of us kids and was showing everybody magic tricks and watching TV, and my mom ran his name and numbers, and pretty soon she calls me back to the dispatch area and she says, "You need to wake up your dad now because this guy is wanted on multiple felony warrants. He's driving a stolen truck." And so I had to go wake up my dad because he was napping before his night shift. He'd worked all day, and I went and told Dad, and he got the guy and he said, "Well, let's go get your gas." And as soon as he got him outside the front door, he arrested him right there. But here we had a wanted felon in our house for about 45 minutes before all the records came back.
Oh my gosh. You could probably write a book. I bet if you stopped and thought about all the interesting characters that came along, I am sure you could have
there was a lot of interesting characters in Whitehall.
Oh my goodness. And so now, fast forward, Whitehall has a great ambulance service, Jefferson Valley EMS, and EMS has been getting pretty established and relatively well, I imagine, around the state. And can you tell us about what the ambulance service in Whitehall looks like today? Does dispatch calls still go to your parents' homes? What does that look like?
Well, my parents both retired here about 10 years ago from at least from dispatching and law enforcement. My dad still, at 81 years of age, takes every ambulance call that comes in.
Really? Wow.
EMS in the state has changed immensely. And, in the early 70s, we were just a ride to the hospital. Now we're an actual moving emergency room. Ambulance services are able to treat patients and to reduce hospital stays. They're able to reduce morbidity and mortality immensely out there. We're able to do 12-lead EKGs and help heart attack patients and get them aspirin and oxygen and IV fluids sooner. We literally can take a heart attack patient, and during our transport to the local hospital, we're able to provide that EKG to the hospital, and the patient leaves a back door of our ambulance, and within 3 minutes can be on a table in the cath lab at the hospital getting a stent and getting that heart attack fixed. And that means less time wasted, and less time wasted means more heart tissues saved. Same way with stroke patients. We're able to do those initial things for patients, like make sure that it's not a blood sugar issue and do that 12-lead EKG and put in IVs and draw blood samples, put them in a patient gown. So that instead of sitting in an emergency room for another 30 minutes to get those things done, they can go straight to the CAT scan to see what kind of stroke they're having so that they can immediately get treatment. And that reduces brain damage and reduces any kind of disability they may have in the future. And I could tell of 100 different things that we can do that reduces time in the hospital for those patients. A really good one is those patients having severe COPD or asthmatic conditions. We can put them on what's called CPAP. And 30 minutes of CPAP literally eliminates the need to have them intubated and put on a ventilator to get them straight.
Wow, that's huge.
And so ambulances have really taken on that role of the country doctor. And, they go to the house, they move those patients, and patients have gotten a lot larger.
Yes.
And when I started in EMS in 1990, the average patient weighed between 100 and 170 pounds. And now the average patient weighs about 230 pounds.
Yes.
And so these patients have a harder time moving. Their families aren't able to move them to the emergency rooms. houses that have been built are not one level anymore, and they're not very conducive to getting people out of them. We had to haul a patient the other day, and she was on the 3rd floor of her house, and had to come down all those stairs, and she lived in the mountains, and so it was a very long process of getting her out of her house.
Oh my goodness.
They've gotten new power loads and power cots and power stair chairs and things to help us move those patients a little easier in the field.
And so, Francine, are all ambulances equal? Like, if I'm going to get in an ambulance in rural eastern Montana, will it have the same capabilities as the Jefferson Valley EMS? Will it be able to remotely send an EKG? Will they all be able to start an IV? Is there variance?
There's quite a bit of variances across the state. There's different levels of ambulances across the states. We have ambulance services that are called basic life support, or BLS. Those ambulance services are able to use, they more than likely will have an AED, an automated external defibrillator, to help try and stop a chaotic cardiac arrest and try to get the person back into a rhythm. They have oxygen. They have a lot of the basic tools, but they do not have medications. They do not have IVs. They do not have advanced monitors that can transmit those EKGs to the hospital. But most of those ambulances do have some kind of, maybe, hopefully, ALS backup, advanced life support, where they have a more advanced ambulance service that they can tie into or meet with. The invent of helicopters has helped a bunch. Now, majority of ambulances in the state are licensed at the basic life support with authorization for advanced life support. And this allows ambulance services to rapidly change the treatment that they can give patients by both the personnel available and the equipment available at that particular time. So in, say, Whitehall, if we have an advanced EMT available that can do all those things with transmitting the EKGs and putting the IVs in and giving a multiple amount of medications, we can operate at that level. Or if we have a paramedic on board, we can operate at the paramedic level. Or if we have the trained staff, such as nurses and a paramedic, we can actually do critical care transports and provide even more care to our patients. And then the last level that we have in the state is the advanced life support, and that is typically your paid services in the state or your helicopter or fixed wing services that always have an paramedic available and that upper level care, and have a very large amount of medications and procedures that they can do to take care of patients.
And those are, I'm guessing, mostly in your urban areas where you have like a hospital that
most of them
owns
are
those ambulances. Okay.
So, and ambulances are owned by a variety of ways in the state of Montana. We have ambulances that are owned by hospital systems. We have ambulances that are owned by the private sector that are for-profit ambulances, and those tend to be in our more urban areas. We have ambulances that are owned by counties. We have ambulances that are owned by towns or cities. We have ambulances that are run by fire departments. And then we have a few ambulances out there that are either run by a nonprofit or some group that has decided that they needed an ambulance in their area.
Oh, okay.
So just a wide variety of ownerships, and there's getting to be ambulances owned by districts now, where they have actually created ambulance districts, and they charge some fees to help support those ambulances.
Oh, interesting. And so do ambulances tend to get funds from taxpayers? Is it?
Depends. So there is a state law that allows for counties to charge up to 3 mills to provide EMS in their counties. There are a few counties that take advantage of that. Some counties, you pay additional funding through the fire departments and in their mill levies if the fire department runs the ambulance. Some counties support their ambulance with taxpayer money. Some ambulances are supported by the resort taxes and the like in West Yellowstone and some of those places. Some of that money for those resort areas goes directly to EMS, because like in West Yellowstone, they have several million people come through that area and they need EMS, so that money goes to help support those. Majority of what runs ambulances is fees for services. So this is where we bill Medicaid, Medicare, private insurance, private pay, workers' comp. Those are things that help pay for EMS.
So if somebody breaks their leg, I think the first thing they think of is, I don't want to have to pay for that ambulance ride. And so you're typically able to bill that person's insurance if they have
Yes.
insurance.
Yes,
Okay.
all ambulance services. We use, a lot of ambulance services now use third-party billers, and they're highly trained in how to do ambulance billing. They charge a percentage of what they collect to help do that billing process. And so they're very good at finding the person's insurance and making sure everything's billed correctly, so the insurance companies pay for that trip to the ED.
Okay. Which, you mentioned all the different technology, AEDs, everything that's on that ambulance. And it's interesting because in Montana, the average length of a call in town is about 45 minutes. But when you start talking about a rural volunteer ambulance service, you're looking at 30 minutes more. So about an hour and a quarter that you could be getting assistance on your ride to the hospital, which seems very worthwhile to me in most cases, in case all of a sudden your condition rapidly deteriorates.
Well, it's like in Whitehall, if we haul a patient to Butte, you're looking at 3 hours it takes you to do that round trip, and that ambulance and that crew is out of service for that 3 hours except for that patient. If we go to Bozeman, it's 4 hours. If we go to Fort Harrison and take a veteran to Fort Harrison, then we're out 5 or 6 hours sometimes. Wow. And so those rural ambulances have to travel further to those hospitals, especially to the level 2 hospitals.
Which normally would just take a person. You think Butte to Whitehall is 30 miles, if that. And then, by the time you go and get somebody and load them up and take them in, that makes sense.
And you have to do quite a bit of patient transfer. It's not, you just don't walk into an emergency room and drop somebody off. You take them in, you move them to the bed, you give an extensive report. The physician questions you, the nurses question you. You sometimes you even have to help with that initial patient care in the emergency room, depending on how busy they are. And you make sure that you have to get signatures and paperwork so that you can complete your electronic patient care reports. So there's just lots of things that happen. And then you have to restock and clean your ambulances.
That's very true. And then EMS also has a different function besides just transporting to the hospital these days, which we've heard about. It's called the Community Integrated Health Program. And I know your ambulance is part of that, and a few others in Montana are. Can you tell us about that?
Yeah, sure. In 2019, the state legislators passed legislation to allow for community integrated health. And community integrated health really for rural EMS is not something new. We've always taken care of our neighbors, and a lot of times they don't need an ambulance ride. They just need their blood pressure checked, or they need help getting off the floor. There's just a variety of things people need that they don't necessarily need an ambulance ride. And this opened up a great opportunity for EMS, and it's so we can help our neighbors even more. And the idea is that healthcare, when done at the emergency room, is super expensive. I mean, it's the most expensive way to get healthcare accomplished. And so if we can keep people from using the emergency rooms as their primary care, or using that as a way to get straightened back out because they're not managing their blood pressure or not managing their cardiovascular disease or their asthma, if we can help them manage some of those chronic diseases before they get bad, we literally save healthcare millions and millions of dollars in the state of Montana. So I was fortunate enough to get involved. Jefferson Valley EMS and Rescue applied for a pilot position in the Community Integrated Health Program. I was able to you have to take college classes to get your endorsement at whatever level emergency care provider you are. And I went to Hennepin Tech and took it online. And it took me about 2 years because when you work full time and you take classes at night, and then I was able to get board certification. I'm one of only a handful of people in the state that's a board certified community paramedic. And in Whitehall, we started a project. We have no hospital in Jefferson County. We have a limited clinic hours in Whitehall where the physicians are only available certain days of the week for certain hours. And so there's a lot of time that people need access to some kind of health care, and they can't necessarily drive to Butte, or maybe they're unable to drive, or maybe they're homebound, that they need help. And so with COVID hitting at about the same time or shortly thereafter, we found ourselves having to help a lot of folks in the community to help manage all kinds of things because they couldn't get into physicians. They couldn't get tested easily for COVID at some points. We even did vaccination clinics for COVID with the help of the local pharmacists. We vaccinated at least 1,500 people.
Wow.
We actually went into the homes and vaccinated people that couldn't even get out of the homes, and the health department couldn't get to. We were able to go into homes and do the COVID tests and draw blood. We had one patient that she was super sick and they didn't know if she had COVID or not, and she had multiple other health problems. And so they sent us in and we drew blood and we did COVID tests and we gave her some initial treatment like fluids because she was super dehydrated, and it all in conjunction with their primary health care physician. We were able to keep her out of the hospital, and they were able to diagnose her without her ever having to step foot in a clinic that had COVID patients coming in and out of, and she didn't have COVID. And so that just saved her from being exposed to a lot of extra sickness that she didn't need to be exposed to.
Right, and to do that all in the home instead of having to deal with the worry and the travel and going out. That's amazing, and that's huge for the vaccination numbers. I mean, 1,500 is probably more than the population of Whitehall, the city, the town itself.
Yeah, it was really nice when we worked with the pharmacy because most of the vaccination programs were very county-based, and so you had to go through your county. And when we did it through the pharmacy, we were able to. Whitehall is where 3 counties meet: Madison, Silverbow, and Jefferson. So we were allowed to let anybody, wherever they came from, whatever county they came from, could get a vaccine. And we even had people from Gallatin County and Broadwater County and places that couldn't get in anywhere else at the time. They were able to come get vaccinations there.
I believe it. And that's one thing that a lot of people forget about is you can be on one end of a county in Montana and all the resources are at the other end. And sometimes it's easier just to go where it's close. So that's great that you guys were able to open up that to others. That's amazing. Definitely. And so with EMS, last year, Montana EMS was activated about 135,000 times and around 89,000 patients were transported. So that difference in number, would that have been something like a community integrated health or a paramedic deciding also too that maybe we don't need to go.
That's the hard thing about EMS. Anyone can call 911. One thing that we get a lot of non-transports to is highway accidents. People are going down the highway, they see an accident, they call 911, and 911's duty is to send both medical and fire and law enforcement to those scenes. Well, today the vehicles are designed so that people don't, if you're wearing your seatbelt, very rarely, unless it's a very significant crash, do you even get injured in those motor vehicle crashes. They may look horrible, but you go on scene and you check out the patient and you evaluate them, and most of the time they decide not to be transported by an ambulance. We also get patients that just need to be lifted. They'll call 911 to get lifted off the floor. Yeah. Some of them think they're really sick, and you go in and you talk to them, and they are not as sick and decide that maybe the best way is to go to their primary care physician instead of go to the emergency department. And usually when we make those decisions not to transport, some of them are very obvious. Some of them are patient-driven. Patients, especially if a family member calls 911 and the patient refuses to go, we cannot kidnap people and take them to the hospital. So some of them, the patients refuse, and there are some that we talk to the emergency department, our physicians, our medical control, or our medical directors, or even the patient's physician to make decisions on what really is the best thing for that patient at that particular time.
Prior to recording this podcast, I had no idea my Montana family used a hearse to get to the hospital all those years ago. Thank you for joining us for this episode of Talking Health in the 406. And thank you to Francine for shedding a little light on an interesting page of Montana's history. Join us for our next episode, where Francine looks at current EMS services in Montana and shares a few great stories as well. For more information on what you heard today and emergency medical services in Montana, check out our website at talkinghealthin406.mt.gov. Until next time, take care.